Hi, everyone. My name is Nikki, and I'm a nurse coach and consultant and a health equity expert. And I'm here today to talk to you a little bit about what are self reflective practices and how do we use them. So, one thing that's really important, just as a foundation, is that oftentimes a challenge I have personally is feeling exclusively othered, right? And exclusionary othering is often a passive process and occurs many times when we're not checking our biases at the door or when we're not realizing that our biases are actually having an impact on the way that we're talking to people or talking to our patients, talking to our clients. When we're not checking those things, we're not really using self reflection. And it happens oftentimes because it's the first things that we notice about folks. It may be their race, their body habitus, their speech, their hairstyle, their language. But when these attributes are labeled and then filed as a way that can be stigmatizing, then oftentimes we judge folks based on what it is that we've seen about them. And what we've seen about them usually is based on either our experiences or what we've been informed by media should be those experiences. And in those ways, I definitely feel exclusively othered, right? But inclusivity is a really incredible approach that invites people in. It develops appreciation and it's very attractive. At least I think so. And self reflection is also about developing a better way to be inclusive. In my workbook, The Clinician's Guide to Microaggressions and Unconscious Bias, I discuss a lot and unpack ways in which clinical instructors, clinical educators, or nurse faculty can really use self reflective practices. And self reflective practices are things that we already know. It's just a way of looking internally to check and see if what our barometer is like, where we are. It helps us manage our emotions. It helps us to approach difficult and divisive topics such as race and inequities in the ways in which people live in society. Some of the ways that I talk about self reflective practices in my workbook is noticing. Noticing is just a part of not trying to change anything, but just noticing how you feel about something. And you may do this practice by yourself where you do noticing before and after. So, for instance, maybe before you teach a class on racism and equity or something that can be very difficult. And then how do you feel after? Noticing is not about changing. It's just about learning how to take note of when biases and things may occur that you have not previously noticed. Another thing I talk about is promoting group trust and relationship building, really creating community. The work of social justice is really collaborative, and we cannot do it by ourselves. So we need to think about this in relationship to each other. That's the part that makes it so inclusive. And another thing that I talk about is creating safety, right? Creating safety, which also helps promote a greater level of mindfulness. When we're being mindful and reflective of what we're saying and what we're doing, we are so much less likely to say and do things that would offend and would cause other people to feel exclusively othered. So, what are some self practices that you do that keep you grounded? What are some self practices that you do that help you check your biases at the door, especially as you're teaching and educating other nursing students and others about how to do this?